In this episode, we're discussing the challenges college students face in recovery with Dr. Michael Broman, assistant professor at The Ohio State University. He shares strategies for creating supportive campus environments and how in-home addiction treatment can help students stay engaged in their academics and their social lives. This is the Well Aware Podcast.
Welcome to another episode of the Well Aware Podcast. I'm Dr. Brian Holzer, CEO of Aware Recovery Care. And as you've seen with some of their episodes, we do certain episodes that have a particular theme in mind. Today, I'm very excited for this conversation because we're going to talk about college-age individuals, particularly those in college that are in recovery, and all of the complexities of someone going to school at an early age in their life and dealing with addiction and trying to navigate towards a position of recovery. With that, I'm so honored today to be joined by Dr. Michael Broman from the Ohio State University College of Social Work, who is an expert in this area, and I'm really looking forward to this conversation today. Welcome to the Well Aware Podcast, and thank you for being here.
Yeah, thank you so much for having me. Also, really excited about this conversation.
Great. At Aware, we do treat folks as young as 17, but our core population is 18 to 64, and we do often treat college-age individuals, which presents a unique set of challenges. This is an area of expertise and research for you, and I would love if maybe you would start off telling our audience about your background and research focus.
Yeah, sure. So this actually goes all the way back to when I was an undergraduate student, which is 20-ish years ago now.
Yeah.
And, went through my own challenges with substance use, to, put it mildly, and was encouraged to seek out treatment and recovery. And so, I followed, I guess, what would be sort of the more traditional structure of like going to an outpatient treatment program that met weekly. And it was recommended to me to, start going to 12-step meetings. So I started doing that. And after a few months of that, it took, and, now I've been clean and sober for 19 years, which is awesome. But I also realized that I had some advantages. I went to college in the same town that I grew up in, which meant that I was able to go back and move in with my family. And so that was a safe environment. So I didn't need to be on campus and exposed to, a lot of the party culture. And so that helped me a lot along the way. And then some years later, I heard that there was something called a collegiate recovery program, which is something that didn't exist at very many institutions at all when I was an undergrad. And I started learning about how these programs offered students in recovery space on campus that they could go to, kind of like a safe space, and activities that they could do on the weekends and recovery meetings. And I was like, that's really awesome. I wish that this is something that was more widely available. And so fast forwarding to 2019, when I was a PhD student in social work at Wayne State, I was actually heading home from a conference, and I just took out this notepad and just started writing down all these ideas about how I wanted to study, the experiences of students in recovery, and especially those that didn't have access to a collegiate recovery program. And I was like, hopefully this will make a difference for somebody, but if nothing else, like at least it will satisfy my own curiosity. And so here we are today, and hopefully that gives you a good kind of sense of, how I got into this line of work and why it's important to me.
Thank you for that. And thank you for sharing your own personal journey with regards to addiction and recovery. Look, I mean, you're younger than me, so it's been a little longer since I was in college, and I cannot imagine being a college student today with the world of social media and the pressure, the peer pressure that not only exists in person now, but online. And I went to a Big Ten school, not Ohio State, Penn State, but the drinking culture was alive and well, and is commonly what you'll see in a Big Ten school or some of the larger schools. Can you, beyond the obvious, can you describe from your perspective, what are some of the unique challenges of being a college student today? And in particular, a college student that struggled with substance use before they got there and is going through a process of recovery while becoming a college student?
That's a really great question. And one challenge that I would say is unique, particularly in today's environment. And this is something that came up in my dissertation study, and now, in a couple of articles that I published along with various colleagues, is there's this sense of isolation. And that's not just for students in recovery. A lot of that actually arose or was exacerbated during the pandemic. But so think about, like, there's already this sense of isolation from the pandemic, and there's never really been a full return to in-person classes. A lot of students are still mostly online. And now that gets compounded by when students are in recovery, they might already feel isolated based on the fact that they're going through just a different path than a lot of their fellow students. The estimate is something like 2.5% of students are in recovery.
Wow.
So yeah, there's this sense of isolation, and it's like, how can I fit in? How can I meet peers that are like me? And I think that can really be a challenge for students. And then you mentioned social media too. And so, yeah, like students are going to be exposed to, I'm sure, like images of other students partying, drinking, and what might look like having fun. But so then this also creates this feeling of stigma and, like standing out in a way that I don't necessarily want to stand out from other students. So that's a real challenge too.
And collegiate recovery initiatives, I've actually never heard of this. And if there was one at Penn State, I certainly wasn't aware of it even today. Can you describe what that is, the prevalence, and how common is it in colleges, and how, even in that case, how common are people aware of it that need these types of services?
Yeah, great questions. So right now there's about, last check, which was a few weeks ago, like 165 collegiate recovery programs in the United States. So that sounds good as a raw number, but then you consider there's about 4,000 institutions of higher education. So percentage is pretty low, but it's really great when they are offered, because one of the key aspects, and the Association of Recovery in Higher Education is the group that it basically like helps people to start collegiate recovery programs, offers a lot of resources, and they have some key recommendations, one of which is that a collegiate recovery program should have a physical space on campus. And the reason for that is then students just have a place they can go and hang out. Like, so for example, here at Ohio State, there's a lounge space, kind of about a 10-minute walk from where I am right now. Pretty nice setup, TVs, video games, food, coffee, and students can just go hang out anytime that they want. They get 24/7 access to that space with a key card. Wow. So that's one thing that's really helpful. And then other key aspects of the collegiate recovery program are having that peer support. So that can really help to cut through that sense of isolation and that sense of feeling different and othered that a lot of students in recovery might experience. And then they'll also offer sometimes what's called an all recovery meeting. So those welcome people in any modality of recovery. Doesn't have to be 12-step, doesn't have to be smart recovery, just any modality. And so those are some of the key aspects. They'll typically also offer some kind of social and or service activities students can get involved in.
That's very helpful. Maybe switching a little bit to prevention. I'm a parent here of kids, multiple kids, and the oldest is about to go away in a few years, and certainly that's going to be living vicariously through my own experiences. What my son might experience is daunting at best. What about prevention? How would you discuss and describe that for parents or children? How does someone avoid the culture of high risk drinking in colleges in the first place?
Yeah, I love this question, and I kind of laugh to myself because I think back on my upbringing, and you mentioned that you're a little older than me, so I'm sure you remember these things too. Like, I can remember going to these assemblies when I was in elementary school in the 1980s and chanting "Just say no," right? Yeah. And we're very clear at this point in the collegiate prevention space that doesn't work. Yeah. In fact, the Higher Education Center for Alcohol and Other Drug Misuse Prevention and Recovery. Center I'm affiliated with here at Ohio State does a lot of work in the prevention space on college campuses. Explicitly says, like, the stuff that we offer is not based on just say no. It's not based on the dare like modality. It's not what does work to address that. So one thing that we find is really important is just for students to have some intentionality and to actually ask themselves, why am I attending this party tonight? What is it that I'm hoping to get out of this? What kind of experience do I want? And not to ask in a way that puts them on the defensive, but really just to help them explore, what their intentions are, because we find that can actually help to prevent some of that higher risk, binge drinking and, consequences that come along with that. And a lot of the approaches that we use now too are based in brief interventions, kind of being mindful of the fact that, like pretty much everyone else in today's world, like students have a ton on their plates. They don't necessarily have a ton of time. So there's actually a really cool program called Basics, and that's a 2-session intervention. It meets an hour one week and then an hour the next week. And it just basically uses motivational interviewing to help students explore, their level of drinking now and if they want to make any changes. And also, I think one thing that's great about that is it's not confrontational, right? So it doesn't say, you must make these changes or else, like some of those approaches of the past, but it just helps them to really explore and think about what they might like to do. And then another thing I'll add too is that having alternative events can be really helpful. So like, for example, some collegiate recovery programs will do sober tailgates. And those will include, they don't just have to be members of the program, they can be other students as well. So.
That's very helpful. You'd already mentioned it once. I'd love to dive a little deeper into the value of peer support. In the Aware Recovery Care model, we have a multidisciplinary team, as I think you know, and the typical folks that people might think, nurses, social workers, nurse practitioners, physicians. But the core of our model is grounded on peer influence and the ability to assign peer coaches to our clients at a very early stage of the program with continuous interactions throughout. And I personally have been awakened to the power of a peer influence, somebody that has been in the shoes of the client going through addiction and recovery. How does this work on college campuses? I mean, you obviously have folks that are also young and peers. Does it really work, and how have you seen peer influence on the college campus affect someone's ability to go through their recovery journey successfully?
Well, one thing as I'm thinking about it that comes to mind is just simply that a peer in recovery can be a role model, and it can sort of not only demystify the recovery process for a young person who might not even be aware that recovery is even a thing, right? I mean, taking it back to my own experience again, when I was 18 and first going to college, I had no idea what recovery even meant. And so I can see, at that time, if I had known somebody in recovery as I was going through my own, increasingly worse struggles with substance use, that could have been really eye-opening to me. So I think having those, visible, available role models can be really helpful. Having people that can, show you the way, so to speak, right? Here's what I did, here's what worked for me. Do you think this might work for you? And I think that's the model in peer recovery coaching in general. And I think that can be particularly effective with college students.
Thank you for that. And maybe focus now on the home setting. In a college campus, that could also be the dorm. But you mentioned the value of having your family live close to where you went to school, and sort of the ability to remove yourself from the campus setting as a mechanism to help with your recovery. Again, at Aware, we operate an in-home care model. Folks do not go to facilities. We come to them. And we have done this on the college campus, where we'll do our treatments within the confines of someone's dormitory or off-campus living. How would you perceive the value of a college student not necessarily having to go somewhere, raise their hand in a group, and have that type of conversation with regards to having access to in-dorm or in off-campus facility meetings where the care team would come to them?
Great question. I also want to say I really love the Aware model. When Aware first reached out to me last month, I looked over, I was like, that's really cool. I didn't realize that this was being done as far as, treatment services. And man, I think that can be so valuable on a college campus for a few reasons. One is just saving a student time, right? Like if somebody can come to me and I don't have to get up and travel, that saves me time. And particularly because a lot of college campuses are not really well set up to provide substance use treatment. What you might have is the counseling and psychological services, which do great work, but they just don't necessarily have the staff and the funding to, meet the need of all the students who might benefit from treatment. And so what will then happen is a student will typically have to go off campus for treatment. Well, now that costs extra time, that costs extra money. What if the student doesn't have a car? There's not an easy bus route. So yeah, I think first and foremost, just logistically, that can be really helpful. But then I think it can also be really helpful in terms of cutting through that stigma, right? Like if I don't need to tell somebody, hey, I need a ride to my treatment program at an age where a lot of people, I think, don't have much of an understanding of what that even means and might have some misconceptions of what that means. I'll take it back to my own experience. Once again, when I was like 18, 19, 20 years old, I had this misconception that if a person needed substance use treatment, that they must be really, really bad off, right? And to be clear, I wasn't in a good state. I was not in a good state at all. But, I had a lot of stereotypes of what that looks like. And so I think that, as a young person, needing to share with, maybe your peer group that that's something you're going through can be really challenging. And so I think that the model that you're talking about can help to address that as well.
Appreciate that. And this has been so helpful for our listeners and for me personally to hear your perspectives. What final takeaways, maybe something we haven't talked about or something with regards to your research that we want to highlight, what would you leave our listeners with as final takeaways with regards to supporting college students in recovery?
Yes, final takeaway. I hope that the audience can be mindful of the fact that, it's already challenging to be a young person in today's society. I know that we were kind of chatting informally before the recording started about, all the social media and how easily people end up being absorbed in that, how they're encouraged to do that. And so it can be challenging to see, images of your peers maybe, looking like they're having a great time. They're not necessarily, but
Right.
it's made to look like that, right? And to feel maybe like an outcast as you're a person that's new in recovery. And you're also dealing with the challenge of academics, and a lot of students now are working part, even full time, might have family responsibilities. So there's a lot that these students are juggling. So I really think that, for one, just hearing their stories and being empathetic, lending an ear, can really go a long way. And then also doing what we can within whatever space we work in, whether it's aware providing treatment services, or me being a collegiate recovery researcher, to try to promote those spaces. That students in recovery can hopefully get some support and connect with each other.
Thank you. And honestly, what I have taken from this is, because I reflect on my own college experience, and I only remember, the harmful drinking culture that existed. You've opened my eyes that this is actually a problem with a solution. And for folks that want to seek services, there is a safe space on many college campuses for folks and their families to seek recovery services and interact with folks that will help them through that journey. So thank you for educating me, and I hope to our listeners as well. It's been a pleasure getting to know you. We're big fans of you and your research. Anything we can do to help you moving forward, we'd love to do that. And thank you again for your time, and have a great day.
Thank you so much. You too. And I'd love to stay connected. Really appreciate it.
Thank you.